The fight against chronic illnesses is starting at the school level as the Ministry of Health, Wellness and Elderly Affairs continues to bring the message of healthy living to St. Lucia's youth. On Friday, September 12, students of the Vieux-Fort Comprehensive Secondary School traded their books for a full day of health and wellness activities, joining the rest of the region in celebrating Caribbean Wellness Day 2025. The initiative, held under the banner of the Saint Lucia Moves campaign, combined education with fun to inspire students to take charge of their health. From a Caribbean Wellness Day themed assembly to a health expo and outdoor sporting challenges, the day placed the spotlight on physical activity, nutrition, mental well-being, and substance use prevention. Dr. Shanna Sear-Filbert, the Senior Medical Officer with responsibility for non-communicable diseases and mental health in the Ministry of Health, Wellness and Elderly Affairs, emphasized that young people are the cornerstone of the ministry's efforts in tackling non-communicable diseases.
It's a wonderful thing to be able to use two very relevant days and initiatives to actually tie in what we want to achieve. So we're trying to get our youth, our future, to embrace healthy lifestyle choices, physical activity, healthy diets, substance non-use. And so we've been having fun here. The students were very engaged, and they actually were the ones who did the assembly to commemorate the day. So they were the ones giving the information to their peers, which was lovely. And we so far with the Saint Lucia Moves initiative, we've been trying to reach out to the schools because we know that that's where everything starts.
Colin Elliott, a family life educator from the Health Education and Communications Unit, who was part of the Health Expo, welcomed the initiative, emphasizing that it provides a timely reminder about the importance of adopting healthy lifestyle practices, especially in a generation increasingly at risk of chronic illnesses.
We have a booth with lots of brochures with information about diabetes, hypertension, cholesterol, breast cancer as well. We've also set up a spin the wheel activity to engage the students and have them just challenge them physically. I believe the activity is important for the students because we are seeing such a spike in diabetes and hypertension in the youth. So it is important to tap into their potential from young and get them engaged and more hyped up about physical education.
Faculty and staff members of the Vieux-Fort Comprehensive Secondary School expressed gratitude for the ministry's efforts in reinforcing these essential life lessons within the school environment.
I think that it is a good initiative, and I think we're happy that we were chosen as well because we recognize that generally our students don't eat healthily, and this is something that we really want to encourage amongst our students. So I think that the message that Ministry of Health brought across in that way is one that will augur well for our students. And not just for here, but beyond the walls, because sometimes what we see they eat, even on the morning as soon as they enter, we wish that it would not be. But this is what it is.
Actually, I appreciate the initiative. When Dr. Filbert brought it to us, it sounded exciting, and especially the little catchy line, Saint Lucia Moves. And though, as you can see, it's a very big compass, our students will tell you about Miss removing all the time. And kind of agreeing with Miss in the sense that our students, they don't eat the healthy snacks, the healthy living lifestyles, like getting the 8 hours of sleep and trying their best to, to put a little more exercise instead of sitting down in the classroom, take a walk during break time and lunchtime, get moving.
With education, engagement, and empowerment at the heart of this year's celebration of Caribbean Wellness Day, the Ministry of Health is sowing the seeds of a healthier generation. One student, one school, and one community at a time. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy reporting.